Hey, welcome to The Explainer. Today we're going to talk about something that, let's be honest, most of us have probably dealt with at some point, even if we didn't call it by its proper name.
You know the one I'm talking about, right? That deep, hacky, rattling cough that just hangs on for weeks, way after the runny nose and sore throat are gone. It's exhausting, it's annoying, and you start to wonder if it's ever going to go away.
Well, chances are you are dealing with bronchitis. But here's the thing you might not know. Bronchitis isn't just one thing. It's really a tale of two very different conditions. Think of one as a temporary, annoying visitor, and the other as a permanent, unwanted resident. So let's break down both of their stories. All right, first things first. When we say bronchitis, what are we actually talking about? What is physically happening down in our lungs that causes that miserable cough? Okay, so at its very core, bronchitis is all about one word: inflammation. I want you to picture the airways in your lungs, your bronchi, like the branches of a tree. When bronchitis hits, the lining of those branches gets really angry, irritated, and swollen. Your body's response is to pump out a ton of extra mucus to try and protect that lining. The problem is, all that gunk starts to clog up the very passages you need for air to flow. And that's it. That deep, hacking cough, that's just your body's desperate attempt to clear everything out. So let's meet the first character in our story, and this is the one most of us are familiar with: acute bronchitis. And the best way to think about this one? It's like that unwelcome house guest who shows up after a cold, totally overstays their welcome, but eventually they do leave. So how does this visitor even get in the door? Well, it almost always piggybacks on another illness, usually a virus like the common cold or the flu. That virus irritates your bronchial tubes, which kicks off that inflammation we just talked about. Your body goes into overdrive making mucus, your airways get narrower, and boom, that's where the nonstop coughing and sometimes that little wheezing sound comes from. Now, here is the absolute key thing to remember about this visitor: the timeline. Your actual cold might be gone in about a week, but the cough from acute bronchitis can stick around for up to 3 weeks. It's a real overstayer for sure. But, and this is the most important part, it does go away. It has an end date. So how do you politely show this visitor the door? Well, since it's almost always caused by a virus, antibiotics are totally useless. This is all about supportive care. Basically, making yourself as comfortable as possible while your body does the hard work. Things like sipping on warm fluids, breathing in some steam from a hot shower, that stuff helps soothe your airways and thin out all that mucus. And rest? That's non-negotiable. You're not really curing it with medicine, you're just helping your body heal itself. Okay, now let's switch gears and talk about our second character. And honestly, this one is much, much more serious. Chronic bronchitis isn't a visitor, it's an unwanted resident that moves in for good and fundamentally changes the way your lungs work. This is the official clinical definition, and you can see right away it's a whole different ballgame. We're talking about a productive cough, the kind that brings up phlegm or mucus that lasts for at least 3 months of the year for 2 years in a row. This isn't a bug you catch. It's a constant, long-term condition. So what allows this permanent resident to move in? Well, the answer could not be more clear. Just look at this chart. While things like long-term exposure to air pollution or chemicals at work can contribute, smoking is the primary cause in a staggering 85% of cases. The constant irritation from smoke creates permanent inflammation and damage that the body just can't keep up with and repair. The story of this unwanted resident is one of slow, sneaky progression. It often starts really subtly, maybe with what people just brush off as a smoker's cough in the morning. But over the years, that cough becomes constant. The sputum, that thick mucus from deep in the lungs, gets heavier. And because the lungs are always compromised, chest infections become way more common. Eventually, even simple things like walking up a flight of stairs can leave you feeling breathless. In its most advanced stages, chronic bronchitis can lead to a very specific clinical profile, and it has a nickname that's, well, it's pretty memorable. It's known as the blue bloater, and it paints a really vivid picture of what severe, long-term airway obstruction does to the entire body. So let's break that name down because it sounds kind of intense, right? The blue part refers to cyanosis. That's a bluish tint to the skin, especially around the lips, and it's caused by a chronic lack of oxygen in the blood. The bloater part refers to fluid retention, or edema, which can cause swelling. This happens because low oxygen levels put a huge strain on the heart, making it struggle, and fluid can back up in the body. So you see, this is way more than just a cough. It's a sign of serious, system-wide distress. Now, I know this all sounds pretty bleak,
But it is not a story without hope. Far from it. While the damage can't be reversed, chronic bronchitis can absolutely be managed. It's about taking back control and working to protect the lung function you have left. When it comes to managing this condition, there is one step that stands head and shoulders above everything else. Step 1 is to stop smoking. Period. Everything else, breathing exercises, medications, avoiding pollution, is a distant second. Quitting is the only thing that can truly slow down the progression of the disease. The medical toolkit here is really all about making breathing easier. You have bronchodilators, often in inhalers, that work to relax and open up those tight airways. You have corticosteroids to help reduce that underlying inflammation. And for people with advanced cases, when the lungs just can't get enough oxygen on their own, oxygen therapy can be a literal lifesaver, reducing the strain on the heart and the whole body. Okay, so we've met our two characters, the short-term annoying visitor and the long-term dangerous resident. Let's put their stories side by side to really hammer home the differences and talk about how we can protect ourselves from both. This table really lays it all out, doesn't it? For acute bronchitis, the visitor, the main cause is a virus, it lasts a few weeks, and the prognosis is good. You make a full recovery. For chronic bronchitis, the resident, the main cause is smoking, the duration is lifelong, and the prognosis is that it's a progressive disease. In fact, chronic bronchitis is a major form of COPD, chronic obstructive pulmonary disease, a really serious lung condition that makes it hard to breathe and only gets worse over time. You can see they are two completely different stories. So, how do we write a better story for our own lungs? Well, the best strategies protect us against both the visitor and the resident. Avoiding smoking is, without a doubt, the single most powerful thing you can do. And then there are the simple things, right? Washing your hands and getting a flu shot helps prevent the viruses that trigger acute bronchitis in the first place. And of course, a healthy diet and regular exercise just make your whole system stronger and more resilient. And that's our explainer on the two tales of bronchitis. When you really think about it, it comes down to this. Our lungs work for us nonstop, 24/7, with every single breath we take. So the question we'll leave you with is, what's one choice you can make today to help them breathe just a little bit easier? Thanks for watching.